That's why the 10-20% comes into role. So you don't get surgery, you're only going to do dieting and you're only going to do exercise. Is my sleep apnea going to be corrected fully? No. It will improve 20-30% maybe, right? Then, for example, you're putting some splints, CPAP. What will happen? Another 10-20% only it will improve. It will never be solved. The solution lies in creating the hypopharyngeal airway. Posterior airway has to be changed, has to be improved. This is the only solution for this. So this is a solution that solves your problem, not by improving it or like that. It will just be cleared. There will be a huge difference for you in your day-to-day activities, in your breathing, in your talking, in everything. Morning sleepiness will go, everything will go away, surely. So we did a major obstructive sleep apnea for this gentleman, and we're going to show you the scans now before and after. We had to do an anti-clockwise movement of the upper jaw along with advancing it. I had to harvest a large piece of rib because we had to do an interpositional grafting. Same time, we've done work on the mandible, rotated it again anti-clockwise, brought it forward 2 levels. At the ramus, also at the chin. A mortis tenon kind of genioplasty, which was an extended one. All of it on these scans before and after that I'm going to show you. So the first up is a front view, and you can see that he's got 1, 2, 3, 4, 5, 6, 7, 8 plates and screws. Now we're going to show you the side view where you will see the improvement straight away. All right. So if I keep it like this, the most important thing you will see is the distance between this tooth and this bone. This is the ramus and this is the area for airway. And look at the improvement now. So we've got this full area for airway. This is not the most precise measurement though. This is just a simple way for me to explain the patient and the patient's relative. But you can see this gap that's created and you can see how little the gap is. Next, you can see the jaw was there. It's come here. So all of this is the extra bone that we've created by the grafting. And then you can see the chin. This bone was there. It's come forward. It's come in a downward direction. And we're going to now show you a different view of this. I'm going to show you more soft tissue views. So we'll move on to the sagittal view. Again, you can see the improvement in the space. You can see that how much of the space that there is improvement as I slide. You can see this improvement. All the areas which are dark in color are the arrows, are the area for airway. I'm just going to roughly measure this. So you have 5 millimeters in vertical height in this area. You can see here, there's an obstruction. You can see there's no gap. And now at the same level of the bone, which is there, which is here, you have 7 millimeters and here there's 0. And I haven't done anything to the soft tissue so much. We've only basically moved the bone around, yeah? We moved it downwards. You can see the difference. And then you can see the chin here. This is the distance in the chin augmentation. I can show you a measurement of that as well. So about 12 millimeters of chin augmentation. And this is the cut. And then you can come and see. Right. So this gentleman has come 1 year now after we did a major bijaw surgery. His main concern was not aesthetics. His main concern was functional problems, sleeping problems, breathing problems. He could not carry on with his life normally. He would, as he put it, sleep when he's on the computer, right? He used to have that problem for how many years?
Like last 2-3 years.
It has worsened.
It has worsened.
And he came to us like this. This is exactly a year ago. And you can see, excuse me, the angle in the neck, the facial form and everything. And here he is now, 1 year after we've done this major sleep study. What was done, I'm going to explain to you a little later with my scans. But first we're going to find out how this surgery has benefited this gentleman.
and the reason why he's back now. So, in terms of differences, you told me earlier 90% improvement is there.
Yeah.
So, for our viewers to understand, what does it exactly mean? People, like, you feel 90% better than what you used to feel before.
Yes.
Okay.
I was feeling sleepy whole day.
Okay.
I was not able to concentrate. I was forgiving things.
Okay, forgetting things.
Forgetting things. So I was not able to concentrate. I cannot do anything. Like, so I feel sleepy
All the time.
all the time. And if I sleep also, it was not affecting my, if I put a watch with the sleeps, it is not showing anything. It is showing only 15 minutes after a full night. After 8 hours, it is showing only I'm sleeping only 15 minutes. And that too, not deep sleep, the other sleep.
Yeah.
So it was not happening.
And after surgery, when did you start experiencing this difference that you're having now? Was it immediately, or after a month, or after 2 months? Was it gradual?
It was because after the surgery, initially the pain and other thing was there, so that I was not able to understand it. But maybe you can say after a month or something, you can feel it properly that you are sleeping. It is affecting your daily life. So you know, while driving, I'm not sleeping, or even on the computers, I'm not sleeping. So it's like, otherwise your eyes are like that, you are getting sleepy
all the time.
And I was getting even like sitting in a car, 5 minutes I'm sleeping and getting snowed. So it's not happening now.
So that means that your life has changed a lot.
Yeah, really.
And also you're able to concentrate on your work.
Yes.
And I did also ask you about the change in your face. Are you happy with that?
Yes.
Okay. So I was mentioning to him earlier that when we do these complex jaw surgeries, and by the way, the only treatment there is for obstructive sleep apnea in the world is it's a jaw surgery. For most patients, this is curative. Yes, there are adjunctive soft tissue procedures. Yes, you could do a septoplasty. Yes, you could do some other procedures with the uvula like a UP3, whatever. But the really conclusive landmark procedure is bi-jaw surgeries, where we improve the airway in the posterior aspect, behind the upper jaw, also behind the lower jaw. In his case, I had done a counterclockwise movement and advancement. So we brought the jaw forward and we tilted it this way so that there is more space backwards where your windpipe is, from where you can breathe, from where you can get airway completely easily. And because we moved that, we had to simultaneously rotate and move the lower jaw as well to get that bite that he needed to get. Plus, we did a genioplasty, a technique which was described by Mortis and Tenen, or that's the technique basically, wherein all the muscles in the chin are moved forwards and downwards in order to get more space by moving the tongue muscles from the hyoid forward. So all of these procedures were done in one go. He stayed with us for almost 10 days.
Yeah.
He works in the Middle East, so he had a recovery of about 3 weeks. He came now, well, also because he's happy with his earlier treatment, but he had some issues with his teeth, right?
Yeah.
So he's able to chew well from the right side. He's not able to chew very well on the left side. He's also having slight issues with some numbness in this area. So we took a scan. I'm going to show you the scan now. So you can see carefully, this is the scan that we have. This was taken, you see this? 5/6/2022. And that was, and this is 24/1. So it's about 11 and a half months. And this was his jaw. Now I'm going to show you very easily certain things that you can understand straight away. So first thing is, this software picks up the scan in the same level. So there's no bias between the before and after. That's the software we have. Now, if you look at this particular view, I'm going to show you a view wherein here you see this gap. Look at this gap and look at this gap. So this is the gap that has been created through which he breathes, through which he's able to breathe even when he sleeps. Huge improvement you can see here all along. all along. Next thing to note is there's a gap now between the teeth and the lower jaw. No gap earlier. So we've created gap here. So what we've basically done is to create a lot of space for him to breathe by moving the entire bony skeleton of the middle face and the lower face outwards, downwards to create this kind. That's why it's more here and less there. Because I told you I did a counterclockwise movement. Why do we need to do a counterclockwise movement for this patient? Because that's how the anatomy was. Depending on the problem with the jaws, we need to move the jaw to increase the airway. I think this is very clearly understood. Now I'm going to show you a similar thing from the other side. And again, you can see that there is a huge improvement in this view also. And we're going to show you the issues. Now, if you look this side, he has no problem on the bite on the right side. But the bite on the left side, there is a gap of about 3 millimeters and 2 millimeters. So our dentist will have to work on this. Since he was in the Middle East, he didn't get a local dentist to sort this out. But our dentist is going to take care of this issue. Apart from that, he has little numbness. That's because those 2 screws that we placed here are not as firm as the remaining 34 odd screws. So these could be removed is what I've told him in case it gets into any problem, but he's fine at the moment. So those are the current concerns that we're going to be addressing. And you can see there are 4 screws, 4 plates on the upper jaw, where the upper jaw was cut and was moved. Yeah, we're going to show you his pictures. And I think he has a nice jawline. Look at that jawline. He didn't have that jawline. This distance has increased. So there's a corresponding improvement, a significant improvement in his facial aesthetics as well. And I'm able to appreciate more after I see the pre-op picture. You can see this height has increased. We're going to show you the front view. Look at that. That's a huge improvement in his facial height, in the balance of the face. And this is the other side. We'll show you this as well. Look at that beautiful jawline. Now that's coming at 120 degrees. He didn't have a jawline. His neck was mixing, was continuous with this, with the cheeks. And this is him in this view now. So I think that's a phenomenal improvement. We're very happy to see him. We've been able to do this life-changing facial makeover bi-jaw surgery with rotation. All right. So anything you want to tell her?
It was very
Painful?
painful for first week.
Okay.
Then pain was a little bit lesser.
Okay.
After two weeks, it was fine. Difficult to, at least 1-2 months, it is difficult to eat something so liquid
Solid.
food only. Yeah.
Yeah, so he's giving you a timeline of healing there. 5 days of quite a lot of pain. 2 weeks where he couldn't eat a lot, even liquids. 2 months before you could start eating a lot of solids. Now, that's the kind of thing you have to be prepared when you go for extensive surgeries. There are patients who are slightly younger than him who would not take this long of recovery, and there are patients who might even take a little bit more. So this recovery period also depends on the type of movements, the amount of movement, and various other issues within the facial skeleton. And I keep telling this to a lot of my patients in surgery. 1 + 1 is not 2 for all patients. For some it's 4 and for some it's 1. It doesn't work like arithmetic. So it's a range that we can give because human body is not the same. A lot of variance in this. Also depends on how well he takes care. Many issues. But overall, you're getting an idea that this is a kind of recovery. But you know, there's a great thing that when you go through these surgeries, it changes your life. It's not going to go back to what it was, even if he puts on another 50 kilos. There are a lot of doctors who advise CPAP. These patients are carrying this device for life, having a very restricted life. All of these things can be done with a plan, assessment of your speech, planned assessment of your, not speech, sorry, sleep, planned assessment of your breathing, and then we can, so we did 2 studies for you, right? 3 actually. We did a sleep polysomnography. It came out as 61, that's AHI index, very severe. And then we did a dynamic sleep study, MRI, and a CBCT here. So 2 to 3 studies are needed. Etna divsa idella cheyambo? 2-3 days we took, or how long we took?
For the sleep study.
No, for the full planning, 1 day, 2 days.
Yeah, 3 days.
So we have taken about 3 days in his case because he doesn't live very far, but it does take a day or 2. So it's something that you have to plan and we have to evaluate, takes time, and then we proceed with the surgery, and then you heard the rest from him. All right. So you want to say something else? Nothing? Thank you.